African Americans will state they are more likely to not get vaccinated because they're worried about missing work, they're worried about not having sick leave, they're worried about having to pay for vaccines. So that's the general concept of access. So some that are unvaccinated is just not because they're anti-vaccine. One final little note to add, the life expectancy from COVID, well, because of COVID, has reduced. The life expectancy has dropped by 1 year throughout the United States, but by 2 years for African Americans. So again, I just want to be clear that it is imperative that we address this. People are dying, getting sick in long COVID, more likely in those that are unvaccinated, even if you get COVID. All right, so why are we not vaccinated? So we have 3-4 other panelists that will speak to this. I want to just focus on one aspect of which is mistrust in the medical system. Blacks have been mistreated by the medical system for as long as we have been in this country. Going back to the enslaved, the medical schools from the North actually came and invaded and took bodies out of the enslaved graveyard cemeteries and brought them up to the medical schools to use as cadavers for their anatomy classes. At the turn of the 20th century, Black women had forced sterilization in the South and in other areas. We all know about the US Public Health Service experiment in Alabama regarding syphilis. That's the one you always hear, but there are others. Studies are showing that African Americans are less likely to get cardiac studies and procedures, stents versus just medication. Lower treatment for pain when they come in with sickle cell and other injuries like femur fractures. So this is all documented. So I want it to be clear that the mistrust with the medical system is valid. So when we address the vaccine hesitancy, when that is the case, we need to not be dismissive. We need not be dismissive whenever there is vaccine hesitancy, and this is for any population. So we need to understand that in terms of getting past hesitancy.
But I think there really is a place for older African Americans and for older Americans to organize, to talk to families and to talk to friends and to be out there very active and engaged in this discussion about vaccinations. And I'm hoping to see that take place as a groundswell from this one suggestion.